changed a little bit when we come to the bone grafting, and especially when we come to the decision-making, bone grafting versus short implants or narrow diameter implants. That's why I like this lecture and the second one also very much. So we'll talk a little bit about the defect types, the intrabony, the extrabony defects, and very important also about the problems. If somebody shows you only nice pictures with, let's say, 100% success, I always wait for 110% success, this is a little bit strange. When I do surgery, I have failures. We can only learn by looking at these failures honestly. So the first thing which should come into your mind when you talk of bone reconstruction is, what type of defect is it? Is it intrabony or extrabony? That sounds simple for you. Of course, it's easier to regenerate the intrabony defect and much more difficult the extrabony non-contained defect. But if I ask you, I see a lot of cases where people use bone substitutes and some membranes in really difficult defects, and then they wonder why this is not working. And I really like the ITI treatment guide on rich augmentation procedures because different viewpoints from different surgeons are in there, and I found the only nice drawing regarding the bony envelope. If I ask you, Stephen, what is the bony envelope? It would be difficult to define this in words, but if you see the picture, you directly understand it is possible to reconstruct something within the alveolar bone. But if you have to reconstruct the whole alveolar bone, then things become difficult. So that's why I like this drawing very much. And I always remember we had the German Society of Implantology meeting, the guideline, and I had to moderate these people. In which indications are we allowed to use bone substitutes? You can imagine big oral maxillofacial surgeons from Germany, they never touch bio-os, they only do autologous bone.